All right. Hello, everyone. Uh, I am Arya Vaibhav Mahajan, and I am here today with Dr. Nitya. Looks like my net is little strange, acting up, but I think you can see Dr. Nitya very clearly. So ignore me. Don't look at me, but look at her because she's the star of the day today, and she's the one who would be talking to us about such meaningful discussions that we all should know about our body. Let me just see if I can work on my camera. It is definitely acting up. Just one moment, please. Let me handle some. Okay, yeah, better. Great. All right. So, hello and welcome, Dr. Nitya Dogga. You are, from what I know, you are a homeopath and a yoga teacher, a yoga specialist, yoga trainer. So, very welcome to you. And she's also I Village client who is using I Village marketing tools. And let's see what. So, over to you. We'll do a rapid fire round. My job is to make sure that whatever doctors say, I decode it for our audience and for your audience, who would be your patients eventually, so they understand uh, how to take care of themselves and how quickly they get the notification that they should connect with you. So,
Got it.
over to you. Would please introduce yourself.
So a very good evening to everybody who's here. I'm Dr. Nitya Dogga. I'm currently based out of Hyderabad. I'm a practicing homeopath for the last 2.5 to 3 years. I'm specializing in pediatric care and women's health, particularly hormonal health, which includes thyroid, PCOD, menopause, and other lifestyle disorders. So yeah, that's it. So please ask your
Cool.
questions. Shoot.
I you are so prepared for it. Okay, yeah. So I usually like I said, I want to keep it easy and very simple for the audience to understand. So just starting from, what are your strengths? I know every doctor specializes in something and very passionate about something. So what is it that what is your specialty?
So given my
Specialty.
experience,
Sorry, I think your strength. Yeah, specialty you mentioned, but strength and specialty together, if you want to say that. Yeah.
Given my experience, I would say women's health, especially hormonal health, because as of today's day and age, we see because of lifestyle disorders, or you can say non-communicable diseases, which are not infectious diseases, are more on the rise. So hormonal health, which includes thyroid and PCOD, that would be my strength.
Okay, so that's your strength. So anyone who has thyroid or PCOD should reach out to you, and you can help us with your homeopathy treatment. But I have a question.
Hmm.
How do I know I have
Right.
thyroid?
Okay. Uh, Weight gain or weight loss, parched skin, which is dry skin, you will see that the texture of your skin has changed. Hair fall, dandruff, these are the most basic signs which will indicate towards thyroid. Now, how or what should like motivate you to go get a blood test done or go see a doctor? One, if you're pregnant, okay, if your one is pregnancy, because that is a huge hormonal up and down in your body. Two, if you're a menopause, if you're perimenopause or menopausal age, which is usually 40 to 45 or 50 or 55 for women depending on their mother and grandmother age. So if you're in the menopausal age. And three, if you have a strong genetic history, if your mother, father, or your grandmother, which is your mother's mother, your nanny, if they have thyroid, then the first thing that should come to your mind is you go get yourself tested. Another sign of another thing which can indicate towards thyroid is irregular period cycle. Right. So these are the most basic things for a woman or
So,
even man.
sorry, I think I lost you. Yeah.
Yeah, I was
So,
saying the most. Please go ahead.
sorry to cut you. I think it's the internet that's bothering us. But please complete your sentence, and I have my question ready. I will ask you.
Right. So I was just saying that these are the most basic symptoms, and even for men, these are the most basic symptoms, minus the irregular periods. But this is what should ideally motivate you to go see a doctor or get a blood test done. That's it.
But in women, like, or in men also, weight gain is such a common thing, I will end up
Hmm.
gaining weight. I like perennial issue. We are all gaining weight all the time as per our thought process. हम ज़्यादा ही weigh कर रहे होते हैं. So
Hmm.
anytime that there's a weight gain, I should think it's thyroid and I should be reaching to a doctor. How is that
Got.
connected?
Now, there are two types of weight gain or weight loss. Okay, one which happens gradually over the years or over a period of time. Like you're feeling well, your body is feeling well, you're feeling healthy. Maybe 1 or 2 years down the line, you see, oh, I was so skinny then, and now I'm a little, on the heavier side. Now, that is a gradual weight gain. It comes with age. Now, then there is something called as immediate weight gain or weight loss, where you're like, you were just 40 kgs last month. Within 45 days you were like, oh, suddenly I've increased so much weight. Like you can, maybe it's 50 or 40, beyond 45. Like increasing 5 to 10 kgs within a span of 1 month is a lot, right? Gaining 1 2 3 kgs is okay, fine, but gaining beyond 5 or 10 kgs, that's a lot of. So that you should be able to assess for yourself. And when there is a weight or weight loss, it affects your energy and your productivity very, very, very clearly. Like you can tell. So that is a very clear cut indicator. And again, another is your dry skin, right? Like I said, summers can cause dry skin, or heat can cause dry skin, or there are other associated conditions which can cause dry skin. But you just know, no matter what you do, how much moisturizer you apply, you can see the scales coming off, or nothing is helping. Like it is a very clear cut indicator.
Okay, now I get it. I mean, all right. So this is great because I may not be knowing about this. If this is happening, I may not know that this is about thyroid. I may just go to a dermatologist and say, can you give me something? This is coming off. So now that you mention it, and weight gain, we may just go to a fitness coach and say, what, I think there's something wrong, and I let me cut down on my weight, etc. But if there's an issue inside, so this is a great understanding that thyroid is something that gain weight is thyroid or lose weight is thyroid, and to just summing up. Gain weight, lose weight, and dry skin.
Dry skin,
Okay.
hair fall, rough.
हेयर फॉल हेयर फॉल भी हमेशा ही रहता है तो कितना एक्सेसिव होना चाहिए कि
But, right, got it. In a day, if your hair fall is 60 to 100 strands, that is normal, which many people have. Because hair is also cell, right? It comes from a cell. So it's always
Correct.
regenerating. So 60 to 100 strands in a day is normal. But beyond that, if it's falling down in bunches or your hair is thinning a lot, it's not looking healthy, then that is the hair fall which should be bothering you. Okay?
Okay,
But
got
60
it.
to 100 strands a day is normal. Nothing to worry.
Right, and we can get this test like even before we think of reaching a doctor. We can just go and get it checked from one of the any close medical lab and something, right?
Anywhere. You can get a full thyroid panel done in any lab. T3, T4, and TSH.
Okay. Okay. Well, this T3, T4, TSH is again a very medical jargon, but I understand. Thyroid test. Okay. Now, you
Thyroid, yeah.
also, I know you're good with PCOD. And my
Hmm.
question, same question. How will a person know, or a female girl, lady know that she is going through PCOD? What are the symptoms?
First thing for a woman to know is what is a normal period for me and what is a abnormal period for me as a woman. Okay, a normal period would be when I'm bleeding somewhere between 3 to 7 days, and my cycle is coming every 28 to, let's say, 35 or 40 days. There is no pain and the blood is coming out with ease, like water. Okay, that is a normal period. There are not much associated symptoms, not too much back pain, not too much leg pain, nothing. That's a normal period. Okay, anything which is not in the bracket of whatever I've told you is abnormal. Pain during period is not normal. Okay,
Oh,
smile is okay, but pain, which women usually say, I have a lot of low back pain or lower abdomen pain, it is not normal. Or when you're bleeding in clots. Okay, especially for PCOD, if there is scanty discharge. What is a scanty discharge? Which is, you're only bleeding 2 to 3 drops, or maybe less than 5 ml. That is a scanty period in a day. Okay, or maybe your flow used to be good flow used to be 5 days, and now it is just one day. Okay, so comparatively, that has changed. Third thing indicator of PCOD is irregular period. So the patient will say, doctor, earlier my period used to come every 32 or 33 days or every 28 days. But now it's coming once in 3 months. Okay. Then another something in patient language is I've gained a lot of weight, especially around the lower abdomen, the lower part of my stomach, or my thighs have gained a lot of weight, or my, there's a lot of weight gain here under my arm. Another indicator of PCOD is abnormal hair growth in women. What is abnormal in women? Hair growing on your cheeks, which is the beard hair for men, or axillary hair, matlab hair in your underarms. That is abnormal because it is for women, the axillary hair is usually soft. It is not as hard as it is for men. Okay, if that becomes harder, or if there's a lot of smell, or if it's growing too much, then that is also another indicator. Okay, then another indicator, very, very important, is cystic acne. What is cystic acne? Not the acne which you get here on your cheeks or here. Acne which you get here on the lower jaw, on the lower part of your cheek, along this bone, along your jawline. It's a little hard. It's a little, maybe discharge will be there. It will be painful. It's very clear, red and clear. Cystic acne. That is also an indicator.
Oh, wow. We didn't, I don't think I knew any of this. I mean, maybe just the pain or part, but this is related to PCOD and it can happen at any age, like after you are pregnant or like after you've delivered or before. Because in my head, somewhere I was told that PCOD is usually for young age girls or, yeah, the early 20s or the early 30, higher, like highest is early 30s, but once you have once you've delivered or you are in the late towards the late 30s and those time, then PCOD stop. Is that so? No.
Uh, Partially, that is correct. Why? I'll tell you, because usually you will see PCOD in uh, 13 to adult age. When I say adult, it is 13 to 25 or 28 or 30 years. Okay. Now, when does it develop in a woman after 30? If you have not had a pregnancy, if you have never conceived, then it can happen in your early 30s or late 30s also, if you have never conceived. Okay. Because the reproductive functionality has not been used, your biological functionality has not been used. Now, I will not get into that, but usually it is seen between the age groups of 13 to 29 or 30. After pregnancy or after a certain age, I have not come across, because the pathology changes in the body by then. The body signs change. So the diagnosis, or as a doctor, I will think beyond PCOD. Like I will, and usually it comes up like that also. It's usually there'll be an ovarian cyst or something else. So the pathology also comes up differently in older women, or women who have already conceived.
Got it. So PCOD, if I may just put it out there, it is a period cycle disorder, right?
Polycystic ovarian disease.
Polycystic ovarian disease. Guys, remember this. This is, to me it is beyond, but that's what I do. I just simplify it. So मुझे समझ में आता है periodic cycle disorder, but nevertheless we got it. Now, if I have to ask this, I mean, this is very interesting about these symptoms that you mentioned, because I know a lot of us wouldn't know that we are going through this issue, but now we can identify कि हमें ये हो सकता है, and this is where we can reach you. Uh, and early sooner, I know that with homeopathy. So if I come to you with, if I may have thyroid or I have these symptoms, or I may have PCOD, and I come to you with symptoms from the homeopathic perspective, how much time does it take for you to help us solve this? क्योंकि बहुत लंबा टाइम किसी को नहीं.
If you have a diagnosed case of thyroid and I'm treating you, then I would ask you to wait for a minimum of 3 to 5 months and get your thyroid tested every month or every 45. Okay. If you have come to me and I'm treating you for PCOD, then I would tell you to get your second scan. Like first scan, usually the patient comes with the first scan with the diagnosis already. So I will always tell you to wait for 6 to 9 months before you get your second scan. Okay, even if you have taken the treatment for only 1 month or 2 months, I would tell you to take the second scan after 6 months. Why? Because it takes time for the body to regularize your hormones and regularize your cycle. Okay, like, yeah. Just to keep it simple, I would tell you to take your second scan done after 6 or 9 months.
Okay, interesting. Cool. This is nice. So you're saying thyroid can be sorted between 3 to 5 months, depending on how severe it is, and PCOD can be sorted between 6 to 9 months.
Ideal time, yes,
Ah.
but no
And we are not
guarantees here.
talking about extreme cases. Yeah, it's our fault if we reach out to you at the extreme end of the situation. So we are not talking about that. But now that we are aware of the symptoms, if any of these things is happening, it just takes 10 minutes to call someone, a nearby path lab, and just say, why don't you come and take my blood test and test me for thyroid? So, and that's about it. We would know. So, guys, if anybody is going through any of these, maybe but not acute, but even if it is in a softer, slower way, then it's important that you know, and you just go and take your test. It's what I would say. Just 1 second. One quick second. Sorry. Okay.
Yeah.
Yeah. Uh, Another. Um, Okay, just absorbing so much information. So, what is that one thing that people can do to avoid getting thyroid, PCOD? I know थोड़ा मुश्किल है आजकल हम खाना भी जो खाते हैं उसमें भी chemicals है सब कुछ है, but whatever, what is it that we can do to not reach a stage where my body says, okay, I have touched thyroid somewhere or there's PCOD? Please help us
Right.
identify those areas.
I tell this to everybody and have told by now you also know me this much, Arya, but three most
Yeah.
basic things I tell: eat well, sleep well, and move well. Now, to go a little deeper into that, sleep for 6 to 8 hours. Deep sleep, sound sleep. You should feel fresh in the morning when you wake up. Eat well. First, the most basic thing is learn to eat on time and home cooked meals, 95 home cooked meals, and learn to eat on time. And move well. Try not to sit in one place or one posture or in one posture for more than half an hour, 45 minutes. These are the three most basic things where we are going bad. So, this is basic that we can do.
Okay, so this is, see, well, eat well, sleep well is such a big thing. Well means what? Oh, how do you describe well?
Well should mean that it gives you a sense of well being. You know that you're feeling good. Okay? When I say weight, it does not mean the kind of weight that you see on the scale every day when you wake up in the morning. The weight which makes you comfortable, which allows you to move, be flexible. Okay, so one is the numbers, the number game is important. Two, the mind game is also important. Okay, so like I said, if you're sleeping erratically, that is bad. But if you're sleeping at the same time and waking up at the same time every day and you're giving your body a routine, then that is good. Okay, now given the lifestyle as a doctor, as a surgeon, let's say if somebody is a surgeon here, they have very erratic hours. Okay, but somehow even between those erratic hours you have to find the time to give something constant to your body. And even like you may have family members or somebody who have very erratic lifestyles. Everybody in today's day and age has some sort of a disease or the other, only because of lifestyle, including doctors, only because we are not able to do the three most basic things in life. That's it.
I know this is a yoga trainer also talking inside you. So it's like sleeping well on time. I just have this thought. If I'm able to do it 5 days in a week, 2 days I can cheat. Is that okay or no?
No,
No? Okay.
it's
Okay.
not
Thank you
okay.
for okay, it's not okay. Got it. Got it. So tell me this: how I know you have been using iVillage marketing tools for some time now, and I'm glad we finally could get time with you to have this session. So,
Yes.
what do you think about iVillage marketing tools? Uh, if this live session happens for 20 minutes and we only could get time today on 27th May at 6 o'clock to be here, but this is generally not something that we do, but ivory's marketing tool is totally away from social media. We are saying that you can help generate awareness organically. So what do you think is has been the importance of ivory's marketing tools in your practice?
Right. So the most important thing to me is my patient comes to me organically. They should want to come to me. I shouldn't have to go to their doorstep and tell them what I do. That is the most important thing for me. And as a doctor, because it builds a rapport, when the patient wants to come to you, it automatically builds a rapport between the doctor and the patient, number one. And as a doctor, the most important thing for me to do is be present with the patient and give medicine. But beyond this, behind the scenes, so many other things happen, especially given the day and age of social media. And because I do a lot of online consulting, so many things happen behind. And I'm very grateful that iVillage is doing the behind the scenes work for me because it eats me into my practice. And the most important thing is that the work is happening based on my work ethics. So that is the way I want things to be done. So that has been a very great support and help.
So glad that you're able to find meaning in our marketing, in the way we market, which is very organic, which is we we put your obviously your details plus about what you want to generate awareness about, and when the patient reads it, or when patients or patient's friend, family, whoever reads it, they come to you because they already are connected with you, because it is very important to have that trust and faith. So if I can't connect to
True.
the message, then I may not come to you. But if the other person is able to, and that is when they come, then obviously you'll be able to do so much more that you can give to that patient, because that patient already feels connected. So those awareness lines are very powerful, and I'm glad that it's working for you, and you think this is going to helping you. Good. I am really glad that this is. So now that I think usually we do a 20-25 minute 20-minute session, so we keep it simple, brief, and in this brief session you've really been able to give us so much insight about um, what is thyroid, why does it happen, the symptoms, and PCOD. I think these are great insight. I will call you again, Dr. Nitya. I know this is your first on screen appearance, and but you're brilliant. Like, your knowledge is so good that we it was crystal clear to me in my head how should I know and what should I do. उसके आगे मैं आपके पास पहुंच जाऊंगी, फिर आपको करना है जो भी करना है. And for me, it's all about trusting you. And I think most of our audience will agree to that. So great. So we will be putting your contact details on the event also. And guys, feel free to reach out to her in case these are the two areas that you want to know. And if you connect with her, then I mean, if you think what she's doing can really help you, if you are suffering through this, don't hold it for very long. It's just one conversation. I think she's so available with technology, is so comfortable. She's available online. Just one conversation, one message will do the job. So please, for your own health, not for her, but for your own health, reach out so that you don't have to take medication in case you need beyond 5 months, beyond 9 months. So sooner the better. We all know this. All right. Thank you, Dr. Nitya. Thank you so much for your time. Appreciate
Thank you
it.
so
And I will definitely hold you again for the next other things that you do, because one message at a time is what I think we all understand better and we retain it. Okay. Thanks. Thank you
much
so
for having
much. Bye.
you.
You're
Bye.
welcome. You're welcome.